So good afternoon, everyone, and welcome to the QGA's first event organized by the 2024-2025 committee. Thank you so much for joining us today for this online clinic. As May is Mental Health Awareness Month, we felt it was important to highlight this topic, reduce the stigma associated with mental health issues, and provide resources that might be helpful to our community and their loved ones. So before we get to the topic at hand, I would like to introduce our speaker, Amber DaCosta. Amber may be the youngest director on our committee, but she has brought and continues to bring a wealth of talent and experience to each of our events. She does wear many hats, as you might have noticed, from being the ever gracious MC at our events to being our DJ, playing all the songs that get the community on their feet and dancing and having fun. So I have the wonderful pleasure also of seeing her amazing violin skills up close, as she's also a member of the QGA's St. Francis Xavier Choir, accompanying our talented singers alongside Nanoshka and me. So Amber has also written wonderful articles about our committee and our events that if you haven't already read them, you can check them out via the links on our website and social media. So today's workshop is a subject that is near and dear to Amber, as she has learned about this topic through psychology classes that she's taken during college. She now works for Bell Canada, which is a company that spearheads the Bell Let's Talk Day that raises funds and awareness for mental health. Furthermore, our speaker is also participating today in the Walk So Kids Can Talk in support of Kids Help Phone that provides help and resources to young people across Canada for their mental health. So just before I give the floor to our speaker, I would like to remind you that you will be able to ask questions at the end of the presentation. You'll be able to raise your hand so I can acknowledge you, or you can write out any comments or questions in the chat. I will be back to let you know when that will be possible. But for now, enjoy the presentation. And without further ado, here's Amber.
Thank you so much, Melissa, for that warm welcome. And I'd like to welcome everyone for joining. Before I get started, I just want to make sure that everyone can see my screen. So just put a thumbs up if I can see you. Perfect. All right. So welcome to our first clinic of this year. Without further ado, let's present the agenda. All right, so we'll start off by understanding what mental health is. I think that's very important before we go on to discuss other things like the factors affecting mental health, then going along with signs and symptoms that maybe you might be affected by mental health. We'll pursue with coping strategies and resources and end with a Q&A and discussion towards the end. So let's get started. So let's start by understanding what mental health is. So according to the Canadian Mental Health Association, or the CMHA, mental health is more than the absence of mental illness. It's a state of well-being. Mental health is about feeling good about who you are, having balance in your life, and managing life's highs and lows. The positive dimension of mental health is stressed in people's ability to realize their potential, cope with the normal stresses of life, work productively, and make meaningful contributions to their communities. So mental health emphasizes that it's just as important as physical health, and it's important to nourish not only our body, but our mind and soul too. So let's discuss some mental health challenges that we may face. So here are some common mental health challenges. There's anxiety disorder, depression, loneliness, OCD, or obsessive compulsive disorder, bipolar disorder. And like I mentioned, these are just an array of mental health challenges. There's so many more. And I know we see the word disorder and we get a bit scared because, we might relate to some of these wordings. We might feel anxious. But let's try to break the stigma around disorder. So as it may carry negative connotations for some, it's used in mental health to aim to reduce the stigma by framing mental health conditions as a legitimate medical issue deserving of understanding, empathy, and appropriate care. So here are a few factors affecting our mental health. So again, these are factors that can influence someone's mental health, but they aren't all. They're just kind of the most common ones. So let's start off with biological factors. So our genetics, predispositions, and brain chemistry can make us more vulnerable to mental health issues. But personalized treatment plans targeting these factors, such as holistic treatments, medication, or therapy, can help manage symptoms and improve overall well being. There's also cultural factors. Cultural beliefs and stigma surrounding mental health can influence help seeking behaviors. So, raising awareness, reducing stigma, and providing culturally competent care can improve access to support and promote positive mental health outcomes across diverse communities, which I think is essential in our community as well. Next up, we have psychological factors. So, past experiences and coping mechanisms shape how we perceive and respond to stressors. But therapy and cognitive behavioral techniques can help reframe negative thoughts patterns and develop healthier coping strategies, promoting resilience and emotional stability. So, for example, suppose someone experienced significant trauma in childhood, leading to deep seated feelings of inadequacy and fear of rejection. As they start to navigate adulthood, these unresolved issues may manifest as chronic anxiety and difficulty forming close relationships. However, through something like therapy, they can explore and reframe these past experiences and develop healthier coping mechanisms and ultimately cultivate more fulfilling and stable interpersonal relationships, leading to improved mental well being. And that said, it is true that our past shapes our future, but it is also our present that can make the biggest change too. After that, we also have environmental factors. So, our physical surrounding impacts our mental health. Have you ever heard the expression a clear space equals a clear mind? That suggests that an organized and clutter free physical environment can contribute to mental clarity and focus. So it's super important to have access to clean environments and green spaces, promoting relaxations and stress reduction. Next up, we have social factors. So, strong social connections and a supportive relationship provides a buffer against mental health challenges. So, investing time in social support networks and fostering inclusive communities can improve mental well being by reducing isolation and increasing feelings of belongingness. And lastly, in this we have life events. So, major life changes can trigger significant stress responses, but building coping skills, seeking support from friends and family, and practicing mindfulness techniques can help navigate these transitions with resilience and adaptability, promoting psychological well being. So, overall, understanding these interconnected factors is essential for promoting mental health and providing holistic support for individuals experiencing mental health challenges. I like this sentence a lot. It says, the stigma associated with asking for help deters mental health even more. So, what does this mean? The more we stigmatize um, a branch of things, the more people want to talk less about it. They think to themselves, what will people think? I don't want to be known as this crazy person if I ask for help. So, here are a few things of what not to do if someone is coming to you for support. Number one, telling a person how to feel. You are not someone else, so you do not know their experiences and the emotions that they live with. So telling someone how to feel and saying things like think positive, sorry, invalidates their feelings. Next, minimizing the problem. People find different things stressful or difficult. So avoid telling someone that their problem is not that bad or that others have it worse because this will just make them feel guilty. Saying, I know how you feel. This may be true to a certain extent, but try not to make the assumption before hearing what that person has to say. Claiming to understand before gaining true understanding of that person's unique perspective may make them feel even less understood. Number four, rushing the conversation. If there's not enough time for you to provide emotional support, do not rush the conversation. This can make that person feel unimportant. Instead, you can say something like, I really want to talk about this, but I have a meeting that I have to get to. So maybe we can talk after lunch or just a time that works better for the both of you. Number five, focusing on one's own needs. People in distress usually do not have the ability to tend to others' feelings. So, talking about how their emotions are affecting others is not helpful. It may only make them feel, again, guilty. So, try to focus on their needs during the conversation and promote positive speech. This means asking them what they want versus what they don't want. And lastly, showing annoyance. Sometimes people treat distress as a discipline problem or a personality failing. For example, a parent may feel this way about a child, so acting annoyed, telling someone to just snap out of it, and similar reactions are likely to make the distress even worse. So, how can we be supportive? Often, when friends seek our advice, we believe we're good listeners. However, we may overlook our own biases and assume that we know what's best, failing to truly listen. Being supportive entails more than offering unsolicited advice or quick solutions, like just go for a run. It involves showing up without judgment, providing reassurance and compassion, and prioritizing the wants and needs of the person seeking support. If you feel like you are not the best person to give out advice or be supportive, that's okay. All you have to do is have two ears and to be present. You can say something like, I want to make it a better and provide the right support, but I'm not sure what to say. I'm still here to listen though, and I want to continue talking. So you don't have to have all the right answers. As long as you're there, being supportive, listening, trying to understand, that's the first step. I'd like to ask the crowd, or if anyone can raise their hand, does anyone know the difference between empathy and compassion? If not, it's okay, I'll explain it. So, empathy is feeling for someone, being like, I understand what you're going through, and I've been there. And on the off side, compassion is very similar. It's feeling for someone plus the desire to help and wanting to help. So, you kind of have to have empathy before you can offer compassion. So, how can I develop empathy? Because empathy is an ability, and any ability can be worked on. So, here are some signs that you may have low empathy. Number one, being critical and judgmental. Number two, thinking it wouldn't happen to you. Number three, calling other people too sensitive. Four, responding in inappropriate ways. Five, having trouble understanding how their behavior affects others. And six, difficulty maintaining relationships. If you relate to a couple of these, this may be a sign that you have low empathy. But rest assured, there are ways to develop your empathy. So let's talk about the different types of empathy before we can go on to the tips. So number one, building cognitive empathy. What is that? This type of empathy is an intellectual understanding of someone else's feelings. It's the ability to consider other perspectives without sensing or experiencing them yourself. For example, if a colleague loses their job, you may recognize what emotions they could be feeling. You could also understand how their emotions might affect their behavior. This doesn't mean you experience the distress yourself. So, how do you build cognitive empathy? Consider asking questions whenever you feel like you don't understand what the other person is feeling. So, you can ask questions like, how do you feel about this? What were you hoping for? Is there anything else going on in your life you may want to talk about? Number two, increasing emotional empathy. Um, what is emotional empathy? So people who have this tend to feel another person's emotions. Although not always the case, this may also include physical sensation consistent with emotion. So let's say you're watching a movie and there's a really, really sad scene and you just start to cry. You're not the one experiencing what that character is going through, but through emotional empathy, you feel like you are, which is why you're crying. Um, So, working on recognizing your own emotions may help you connect with other people. Not everyone will recognize how they feel at all times or why they act in a certain way. So, learning to connect your emotions with your actions may help you connect with other people's emotions too. So, by developing both our cognitive empathy and emotional empathy, we become better equipped to show compassion and effectively support our friends and family in times of needs. Now, we'll go into some signs and symptoms of mental health issues. So, these are just a few again. It can vary widely depending on the specific condition and individual factors. But here's some general signs and symptoms that may indicate a person is experiencing mental health challenges. Number one, changes in mood. So, this persistent feeling of sadness, irritability, or mood swings. Number two, changes in behavior. So, withdrawal from social activities, increased alcohol or drug use, changes in sleep patterns. Number three, difficulty concentrating. So, if you have trouble focusing, making decisions, or remembering things. There's also physical symptoms, so unexplainable aches and pains, changes in your weight or frequent headaches, stomach aches. Number five, extreme fears or worries. So if you have any intense or irrational fears or worries that interferes with your daily activities. Six, decreased functioning, so difficulty coping with daily responsibilities, finding work or school or just your daily chores a little too hard. Changes in appearances, increased sensitivity, so having heightened sensitivity to your senses. So if you find sound, smells, or touch and sights a bit too overwhelming. And lastly, suicidal thoughts and relationship difficulties. So it's essential to note that experiencing one or more of these symptoms doesn't necessarily mean a person has a mental disorder. However, if these symptoms persist and significantly impact daily functioning and quality of life, it's essential to seek help from a mental health professional for evaluation or support. And early intervention and treatment can often lead to better outcomes. So let's talk about some coping strategies and resources. So here are just a few coping strategies. We have self-care. This means to engage in activities that promote physical and emotional well-being, like exercising, healthy eating, getting enough sleep, practicing relaxation, deep breathing. We have social support. So reach out to friends, family members, support groups, and create those connections. Talking to someone you trust about your feelings can help reduce feelings of isolation. Therapy and counseling, mindfulness and meditation. Practice mindfulness techniques to stay present and reduce stress. So, this can include meditation, yoga, or just taking simple moments throughout your day to focus on your breath and sensation in the present moment. Five, healthy boundaries. Set boundaries to protect your mental health and emotional well being. This may involve saying no to commitments that may seem a little too overwhelming for you, limiting exposure to negative influences, and prioritizing activities that bring you joy and fulfillment. Six, journaling. This is one that I like a lot. So write down your thoughts and feelings in a journal as a way to process emotions, gain insight into patterns. I think this is one of a great ways to recognize patterns in your day-to-day life and track your progress over time. Creative outlets. So engage in creative activities that allow you to express yourself, such as in the arts, music, writing, crafting. Creative expression can be super therapeutic and provide a sense of accomplishments and fulfillment. And it seems like nowadays no one really wants to or doesn't seem to prioritize creative outlets and our desire to seek and express ourselves. We're kind of more focused on our jobs and our day-to-day life that we kind of lose track of who we are. And the more that we take the time to be ourselves, the more we're connected in what we do and how we do them. Next, we have physical activity. Obviously, moving your body will have a trickle effect into your mind as well. So moving your body has a lot of positive effects on moods and your overall mental health. Nine, mind body practices. This means things like Tai Chi or progressive muscle relaxation to promote relaxation and stress reduction. We also have seeking professional help. So, if coping strategies alone are not sufficient, don't hesitate to seek professional help from a therapist, psychiatrist, or other mental health professional. They can provide so much support and guidance, treatments tailored to your needs. And number 11, one of my favorites, continuing to educate yourself. As you can see from this presentation, mental health is a huge topic. There's so many things that we can learn every day and educate ourselves on, and it doesn't stop at the basics of what is mental health. And here are some things that you can do. It's not something that can be fit into a little pocket-sized booklet. There's so many things that might intrigue you and you might relate to even more, like, I'm really interested in self-care practices. I'd like to know more about intersectionality, or how I can support my peers. I've also highlighted here mental health and nutrition because I'd like to announce that our next clinic, which will be happening on July 7th, will be a sip and soak hosted by Charmaine, one of our committee members, on how nutrition plays a factor in our mental health. So look forward to that because it'll be so much fun to unwind in the hot summer and listen to Charmaine. All right. And for the resources, there's so many resources that exist. We have the Quebec Mental Health Association that offer many links to support. We also have the Canadian Mental Health Association, as well as so many virtual counseling. And did you know there are different types of therapists depending on your need? It does not stop at just a psychologist. You can have someone that's geared to your needs. So if you were looking for a psychotherapist, a licensed psychologist, counselor, addiction counselor, there's so many out there that are just waiting to to help out. And also check your insurances because a lot of people are unaware that their insurances might include mental health, um, because this is just a huge thing now. So I'm sure that there are offers on this as well. That said, thank you so much, everyone, for joining me on this topic. It's been so much fun organizing this for you guys. And I'd like to open the floor for a Q&A and discussion. Thank you.
Thank you so much for that great presentation, Amber. As she mentioned, we're now going to have a question period. So if you'd like to ask a question or you'd like to make a comment, please either raise your hand or you can write it in the chat and we'll acknowledge you by name or we'll read out the message.
I have something I wanted to mention. There was a time when I went through a very exceedingly hard time following the death of my brother. And it was very, very tough at that time to deal with something that we were not prepared for as a family. It was not something we envisioned, something we expected. And it happened so tragically and unexpectedly that we were just swept into it. We didn't have any choice. And dealing with that was exceedingly difficult. And it caused many, many feelings within the family members. Each one tried to cope as best as we could. I have to say that eventually, even though I thought I was going through my daily life, I realized how it was impacting me, where I finally had to seek help, go for counseling, because it impacted me on different levels at work, at home, in my thoughts, and not being able to sleep. Went through a depression, and all of that had to be looked at and examined. And it was a tough time indeed. So I'm glad I was able to get the help that I needed at that time, but it took a long time. Even though I got that help at that time, I've been working in this. I worked in psychiatry. I worked with Kids Help Phone. I worked in that mental health field. It was still not easy. And it took many, many years to reach that level of peace eventually within me. So I just wanted to make a comment on that.
Thank you for
And
that,
sometimes,
Fiona. And
yeah,
yeah,
sorry,
go
go
ahead.
ahead.
No, I would just like to thank you for sharing that. I know it's super hard dealing with grief and not feeling like anyone can understand that at the time and how to cope with that and seek help. But I'm glad that you did and found a community out of it too.
What I did find, because I worked at Kids Health Home, there were kids that came to me with darkness that they were experiencing that I could empathize with because I was experiencing the same darkness. So there was a connection almost on a heart-to-heart level, which helped me to help them. And
Mhm.
maybe things happen that way because, I mean, I look at it, I was there for them when they were going through a hard time, but it was exceedingly hard for me too.
Thanks for that, sharing that experience, Fiona. I think Charmaine has a question.
Yeah, I just unmuted myself. Can you hear me?
Yes, we can.
Great. Amber, thank you so much. That was really well put together. Appreciate um the making the time for it. And I think whether it's May or any time of the year, I think mental health awareness has been really something that that people don't know how to necessarily speak off and deal with.
Mhm.
And so I feel that was a really brilliant move on your part. And Fiona, thanks for sharing. And so I will share something that I feel is super important with the whole mental health awareness, and that is this, that um, culturally different people have a different approach to what equals mental health that's compromised. And so some cultures are better at dealing with it, and others kind of want to sweep it under the rug. And they'd rather talk about a pain in the knee than having something that is a heartache or a just confusion, brain fog, things like that. And I feel that one of the things that every one of us can do, and I've learned to do from being exposed to so much of it, is um, that that what it is that we say becomes really important to what it is that we're thinking. So things that I've heard people say are and I think the understanding of what equals darkness, people have this preconceived idea as to that's not that dark. I've experienced something darker. And there's this comparison that happens to what is one person's grief, and but that's not that bad. Here, let me tell you about my story, about my friend's grief, or what I've experienced. And before you know it, the best way we can be there for somebody else, we think, is to share, is to right away take that story and now create your own story. And I've realized that is definitely something that we should stay away from, that particular strategy of jumping in with your own story, as well as feeling that one of the other things is um, when I've heard somebody say I don't quite understand what I'm going through. And oftentimes culturally, and when I say culturally, I'll say probably more within my Goan culture. I don't know. Most of my friends, as in my mom's mom and dad circles, are Goan, and so culturally, then the knee jerk is to say, "Oh, you'll get better. It'll pass. You'll get over. Time will make things better." And what I've realized is that none of those things actually work, because they just don't, because what it is that you feel is not necessarily something that somebody else even understands. And so what I've come to realize is the better thing to say or not to say is to appreciate that what that person's feeling right now is something that is big. And that if the pain has come with grief, like a dog dying, as was my grief, then it's not okay to say you'll get another dog. It's okay. or it's not okay to say it'll pass. It's not okay to say if somebody's house burns down, oh, you still haven't gotten something together. Or those are just things that feel that just make you realize that the understanding of what that person is going through has not even been processed, and that the person has not even been listened to. So I think my comment is that we are so fast to give out comments because we think we're saying the right thing, but culturally we're just not okay with even hearing like someone in the family that said she OD'd, but dare we talk about her ODing, because that would mean actually admitting that someone in the family was sick and that we didn't realize it. And so I think my comment is to allow for space, that if we don't know what to say, then not say much or anything, and to allow for grief to exist for as long as grief needs to exist, and that grief does not need to pass. Because when you love, you'll always, when there's grief, there's love, and love can never end. And that's my comment.
That was a very important
Beautiful.
point. That was a really, really great point. I was just about to say that I totally agree with you on that aspect. I think we've all lived through family members, generations where they tackled things in such a different way, and they never realized, or they haven't moved with the times on certain things, that we have the resources, we have the people, we have the methods to make things better, and we can't use archaic ideologies to kind of deal with the situation that's happening to a person in this day and age. And every current generation, the younger generations, need to know they have access to these type of resources. They have the help that is necessary. And you hit on the nail on the head exactly for what I was thinking. You cannot minimize something that someone's feeling. The emotions can be extremely intense for something that is very minor to someone else, but could be the end of the world to someone else. So the loss of a pet, something that, you know, people don't realize, it's a family member in so many ways. It's like losing something, even if it is material, tangible things, they're just as painful because they're a part of you. They were part of what you lived through, and that doesn't change. I mean, that doesn't change in terms of who you are as a person. It's part of you. You can't erase that or remove that in any way. So I feel even as healthcare providers, for those who work in the healthcare field, we have to keep that in mind when we talk to patients or other people, that it doesn't stop with like, yeah, we're going to fix your problem. It's going to be, I need to better understand where you're coming from, because it's something extremely big to you. And if I can't put my mind frame into that state of mind, I can't be there to help you in the right way.
Right. Yeah. But thanks for listening.
Well said, Charmaine, as well as Priscilla. I agree with you totally.
Does anyone else have any comments or experiences that they would like to share?
I just wanted to give appreciation for Amber for creating the document, and it's I my memory is very low, so if we could get a brief outline of what she had done, and I would like to keep it. Is it what?
Yeah,
That's all I want to mention. It was good. I'd say you see a lot of things. I mean, I am sometimes not aware of certain things. So, anyways,
mhm.
yes, just to thank you for the nice. See, I have a problem now. Is I cannot get the words, or so it takes me time. I get a block in between, and I'm working through it. It comes to mind after some time.
That's all right. And thank you so much for your kind words. I'm hoping that we can send this out to the committee members. So everyone will also have access to the links, because they are hyperlinks that you could click on, and it will direct you to any type of resources. And there was a lot of content in all of this. So rereading this and going through it again would be very beneficial for
Yes.
everyone, I think.
reinforce
thank you.
what we learned today. It's good.
Yeah, that's absolutely right. I definitely think we can get your presentation out to the community, and
Yeah.
this whole presentation is actually being recorded. So if anyone wants to rewatch it, they can re-see it.
Okay. Thank you. Have a
Thank
good day.
Thank you.
Thank you. Bye.
Bye.
Thank you.
Thank you.
Thanks, Shari.
All right. Thanks, everyone.
Thanks, everyone.
Thank you.
Amber,
Bye.
Yes.
I just wanted to say you've done a very good job. Thank you for putting it together. Well
We
done.
are,
Thanks, Fiona.
Thank you so much, because it's important that we remind, this is a reminder to all of us as to how we can interact with each other when we're going through difficult times. So thank you for that.
Hmm. Of course. I think this is one of many of, or the start of something great for our clinic.
Mhm.
we have to take a picture with all the people before you all leave. Hi, this is Blanche, the president. So I would ask everyone to still stay because it's not done yet. We would like to take a group picture if possible. So turn your cameras on. I, for one, cannot turn mine, so I'm having difficulty. But if you all are in, please turn on your cameras, and Melissa will do the rest. And the recording will be sent out to you shortly. Also,
Thank
we
you.
will post it on YouTube, right?
Yes, that's right.
Yeah. I would like to also thank each and every one of you for tuning in and listening in to Amber's very, very informative clinic. I hope you all learned a lot. Thank you very much, Amber, for an excellent job, excellent presentation. Thank you, Melissa, Priscilla, for helping out. Thank you, Natasha, for uh, putting it all up for us. And thanks to all the QGA community for tuning in. And also, I would like to remind that there will be a bus trip going to Cap de la Madeleine, which is happening on the 20th of July. So I would like you all to reserve your seats because the seats are going very fast. And so if you all really would like to go, please let us know, send us your payment. And we have decided to make 4 different stops for the sake of all our people, so who do not have the means to travel on their own. So please let us know if you all are interested in joining the bus trip. And yeah, thank you once again for everybody. And please switch on your cameras so we can take a group picture.
Ross, how do you put that in the camera? I don't know. Help.
Your camera is on.
Camera's already on. It's okay.
Yeah.
For everybody else, they can put theirs on. I guess that's it for now. Okay. Okay, well, I'll take the picture.
What about all these people, whoever were there on the chat? I think we have still 12 participants. Ninashka, can you turn your camera on? Christopher, Prem,
Yeah.
Ollie, Olga. Annette is gone.
I think
I
it's
don't. Annette is in. Annette, turn your camera on, please. All the QGA committee. I think Dorita's camera is on.
yeah, her camera's on. It's good. Yeah.
And Zia is not in, right? I had seen her a while ago.
Okay, so we're not waiting for Olga or Annette. Okay, we'll take the first picture. We'll take a shot.
Yeah, take a shot.
Okay, everyone smile. Okay, just check it just to see if it came out okay. Yeah, it looks really good. Looks good.
Yeah.
Thank you.
Give a second a second call.
Thank you.
A second
you.
picture. Okay, another shot.
Uh,
Everyone's ready?
Olga, can you turn on your camera?
Oh, okay.
Olga.
Okay, so everyone's ready. I'm gonna take the picture in 3, 2, 1. Smile.
Oh, hold on, Melissa. I'll go down where Amber is. I can get a.
It's okay.
Annette, you're not totally in the picture.
Oh, now we got Blanche. Okay, perfect. Okay, so everyone's ready? Okay, so 3, 2, 1, smile. Okay, let's just see. Yep, looks good. Yeah, it looks good.
All right.
Thank you.
Thank you.
Bye-bye.
Thank you. Take care.
Everyone,
Have a good-
everyone, have a great rest
Good
of the
week.
day. Great rest of the day.
Bye.
Thank you, Amber. Thank you so much.
No problem. Have a good one,
Bye.
everyone.
Take
Good
care.
job,
Bye.
Amber.
Thanks, Chris.
Bye. Bye.